In this chapter, we will be talking about drugs for Alzheimer's and Parkinson's disease. Lesson objectives for this class, we will be talking about drugs that used to treat Alzheimer's disease and Parkinson's disease. List out the names, effects, side effects, adverse reaction, or adverse effects of the drugs for this conditions. What to do before and after giving the medications. What to do, what not to do, and when to call the doctor, and lifespan considerations as well. So a quick overview. Alzheimer's and Parkinson's disease are both progressive and neurologic disorders that are more common in people as they age. Alzheimer's disease is the most common form of dementia, while Parkinson's is a neurodegenerative disease with slow progressive degeneration of the nervous system. So both conditions involve interrupted transmission of nerve impulses. So know that both Alzheimer's or Parkinson's disease are under the umbrella of dementia. So let's talk about Alzheimer's disease. So Alzheimer's disease is progressive and incurable. It destroys brain cells with a gradual loss of intellectual abilities such as memories and changes in personality as well as their behavior. It mainly affects their ability to perform activities of daily living, remembering, and as well as reasoning. So there are pathologic changes when it comes to Alzheimer's disease. Um, there are large amounts of beta amyloid that is present during this condition, which is a protein that clumps together and forms a plaque in between the brain cells. So once these plaques form, they push towards in between the brain cells. They can also twist and tangles within the neurons. What will happen is there will be neuron death in the areas of the brain particularly responsible for memory and other essential mental abilities. And then the connection between the nerve cells and is also disrupted, and the levels of chemical known as ACTH or acetylcholine or acetylcholinesterase, which carry messages between the nerve cells, are also decreased. So the first sign of Alzheimer's is mild forgetfulness, and then later, towards the end of the condition, patient will need total care and eventually lead to death. This is just a difference between a normal brain and a brain with Alzheimer's. So this is what a normal brain looks like, while this is the brain with Alzheimer's. As you can see, density of the brain is definitely decreased when it comes to the memory section and language section. So we talked about types of drugs that are used for Alzheimer's disease. We have your cholinesterase, acetylcholinesterase inhibitors, which reduce the activity of the enzyme acetylcholinesterase. So this breaks down acetylcholinesterase breaks down acetylcholine in the synapse of the neurons. So this action keeps the level of acetylcholine higher. Therefore, it preserves whatever can be preserved. These drugs are used to early to moderate stages of Alzheimer's, and their effect is definitely just temporary. So there are three drugs that are included in this category. You have your donazepam or your Aricept, rivastigmine or your Exelon, as well as your galantamine, which is your Reminol. These are the main ones that are used for Alzheimer's disease. So the intention of this medication is to decrease dementia temporarily and inhibits degradation of acetylcholine, slows the progression of the symptoms, and improves cognitive function. Side effects include nausea, vomiting, diarrhea, stomach cramping, headaches, dizziness, fatigue, weakness, insomnia, and sometimes loss of appetite, which can lead to anorexia. One of the common side effects of your memantine or your Namenda includes dizziness, headache, constipation, and confusion. This drug can also cause nausea. When it comes to adverse effects, it can lead to abnormal heart rhythm or arrhythmia, GI bleeding, difficulty urinating or seizures, and shortness of breath as well as hallucinations. Before giving this medication, you have to have a complete list of drugs that the patient is currently on. You have to know their baseline cognitive function, baseline vital signs, weight, gastrointestinal status, urinary status, hemoglobin and hematocrit levels, and to see if they have any swallowing difficulty. You also need to ask if they have any presence of liver or kidney issues. After giving this medication, you have to check their cognitive function to see if the medication is working, monitor their blood pressure, heart rate, intake and output, as well as their daily weights, and of course, ask about the nausea, vomiting, and possible GI discomfort. Well, you need to teach your patient to take this medication as prescribed. When we are giving extended release medication or your ER medication, please make sure that you do not crush them because it's made for extended release. You have to follow up with your doctor as requested. These medications can cause dizziness, weakness, and fatigue, so you have to give this medication um, and make sure that the patient is safe after giving this medication. Notify the doctor for any signs of bleeding. Take this medication with food if GI upset occurs. And no, you have to educate them that the goal of this medication is just temporary improvement and will not cure the disease. Lifespan consideration for older adults, you have to use this cautiously with patients who have a history of GI bleeding, liver and kidney problems, as well as heart disease. So when we talk about your Exelon, you have to use this cautiously with asthma and COPD. For older patients, frail females should not take over 5 milligrams a day of this medication. And these medications can increase incontinent episodes. When we talked about Parkinson's disease, this is a slow progressive degenerative disease of the nervous system. Um, in the United States, about 1 million people are affected by this disease. It affects 1 in 20 people of ages 80 and older. Commonly begins between the ages of 50 and 79. The exact cause of this condition is unknown. However, there are several factors that can play part, such as age. Is a major risk factor. Genetics and definitely environmental factor can have a possibility of contribution to this disease. They have identified 2 abnormal genes that have been identified in people with Parkinson's disease over the age of 40. Symptoms of this disease includes tremors at rest, rigidity, stiffness, stoop posture, and balance issues. They have this Parkinsonian gait that they usually say. Drugs can make the movement easier and prolong the normal function. However, again, it will not cure the disease. So just a quick pathophysiology of this medication. So in Parkinson's disease, the nerve cells degenerate in a part of the basal ganglia called the substantia nigra. The substantia nigra causes this degradation in substantia nigra causes a decrease in the production of dopamine and in the number of connections between the nerve cells and the basal ganglia. What would happen is that the basal ganglia are less able to produce smooth movements. That's why you have this motor symptoms as well as non-motor symptoms, but particularly motor symptoms for patients with Parkinson's disease, such as bradykinesia, lack of facial expression, so have flat affect, stooped or shuffling gait, and of course their tremor. They will also have this rolling pin condition that usually present in patients with Parkinson's disease. So drugs that treat are used to treat Parkinson's disease. You have your dopaminergic and dopamine agonist, which increases the activity of dopamine in the brain. You have your carbidopa, levodopa, which is the most common one, as well as the Requip or ropinirole. You also have your COMT inhibitors, known to allow more levodopa to reach the brain, which is usually your Comptan. That's the name of the medication, COMTAN, and that's the generic name of that is entacapone. You also have your MAOB inhibitors, which inhibit the enzyme that breaks down dopamine in the brain. So as you can see, dopamine is very important for patients with Parkinson's disease because that's what they're lacking of. So you have to increase the amount of dopamine that they receive. You can also give them medications for anticholinergic, which blocks the cholinergic nerve impulses that help control the muscles. The intention of this medication is to decrease the signs and symptoms and to relieve tremors or rigidity of the patient. Side effects includes dizziness, nausea, and hypotension. Adverse effects can include depression with suicidal tendencies, neutropenia, and neuroleptic malignant syndrome. Life-threatening condition can lead to CNS depression, which can lead to shock, acute myocardial infarction, as well as narcolepsy and rhabdomyolysis. Before giving this medication, you have to know the patient's blood medication list, baseline blood pressure, heart rate, and respiratory rate. Know their baseline neurologic and mental status, any pre-existing dyskinesia, rigidity, tremors, gait, or swallowing ability, as well as any history of kidney or liver problems. After this medication, or while on the course of this medication, you have to monitor their vital signs every 4 to 8 hours to assess their mental status, ask for side effects of the drug, reassess for bladder distension, monitor intake and output, check the skin condition, and of course monitor if the medications are actually working. Teach your patient to take this medication as prescribed. Never crush extended release tablets. Do not take a double dosage of the drugs. Drugs are used to control the symptoms. Again, this is not a cure. Do not overdo physical activities and to avoid falls or injuries. Take this drug with food or milk if GI upset occurs. Have regular eye exam. Avoid large amounts of chocolate and caffeine in the diet, and avoid overheating in hot weather. Lifespan consideration. This has not been tested for women and for pregnant women and lactation. This is only used if the medication risks outweighs the benefits outweighs the risks. Bromocriptine or Parlodel is not recommended for pregnancy as this gets released in the breast milk. For older adults, they are more sensitive to the side effects of the drug. Change position slowly. Confusion can occur, hallucination as well as uncontrolled body movements, and possible falls. So you have to use handrails on stairs and protection.